Again, good morning, and thank you for joining us to talk about cyclospora. I'm Rebecca Munnerlin with Prisma Health Media Relations. Today, we're joined by Prisma Health Infectious Diseases Specialist, Dr. Helmut Albrecht, who can provide helpful background on the foodborne illness caused by the cyclospora parasite we're hearing about in the news. Outbreaks have been reported in several states as authorities work to determine the source. Also with us today is Chelsea Bruce, our registered dietitian, with some tips on selecting and preparing foods to hopefully avoid causing contaminants. We'll start with Dr. Albrecht. Um, Dr. Albrecht, for those who are just now learning about cyclospora, who maybe haven't been so tuned in as we have, what is this parasite and how do people typically become infected?
Yeah, good morning, everyone, and thank you for getting us together, Rebecca and Tammy. And I really love that title, Romaine Calm. I love that. But back to the question, however, what is cyclospora and how do you catch it? First of all, it is indeed a parasite, not what we usually see with foodborne illnesses, which are bacteria like salmonella or viruses like rotavirus or norovirus that you're used to. This is very different and has a much more complicated and different transmission pattern. Cyclospora exists in the environment. It's shed there, we think, only by humans, and exists in the environment as spores. In order to become infectious, it needs to crack open these spores and release the parasite. And that requires a certain temperature, a certain heat. So it is generally a summer illness. We used to see a lot of this as traveler's diarrhea acquired overseas, but in the last couple of years, it certainly has caused a lot more locally acquired disease, i.e. infections in the US. And we see these popping up every year now in the summer with dozens of outbreaks all over the US. What's different this year is that the main outbreak and some of the smaller outbreaks have a much larger scale. Part of that is awareness, but part of this is we're seeing a lot more of that. And we're not dealing with one outbreak, we're already now dealing with several dozen outbreaks, and that's fairly typical.
Can a person spread cyclospora directly to other people?
No, that's really difficult. The spore that I talked about needs to mature in the environment, and depending on the temperature, it takes about 1 to 2 weeks and may take longer. So it's very unlikely that you see direct human-to-human transmission. Infected people, however, can shed it into the environment, into water sources that are then sprinkled on veggies and salads, and that creates new outbreaks.
Got it. So how is the illness different from, well, and you've covered this a little bit, but is there anything else that you would like to tell us about how this is different from a typical stomach bug or food poisoning? And talk a little bit about how the symptoms begin and how long that takes and lasts.
Yeah, first it takes a little longer to develop because of this complicated pattern, but the incubation period, which is the time from an infection to symptoms, is a week or so, which is longer than other foodborne illnesses. It typically doesn't cause fever like the bacterial ones do, such as salmonella. It does not cause bloody diarrhea, um, but on the unpleasant scale, it is way up there. People report explosive diarrhea for weeks, and this is as unpleasant as that sounds. And if untreated, it doesn't last a couple of days, like you ate something wrong, a day of diarrhea. This, you were talking days to weeks and even longer in patients with a weakened immune system. So again, not more dangerous, but more unpleasant.
That sounds terrible. I've always heard that when you have food poisoning, it usually starts very quickly. which is different from this.
And you usually have much more of nausea, throwing up. This is really a loss of water for some time.
Understood. Well, who is most at risk for serious complications from cyclospora infection, and when should someone contact a healthcare provider?
Well, most of us, it's per se not dangerous at all to get this. It does not burst your intestine open. It does not cause threatening bleeding. People don't feel terribly ill with this. Again, but it's unpleasant, really unpleasant rather than threatening. And most of us will get over this without doing anything. Like any diarrheal illness, however, it can cause us to lose significant amounts of water and electrolytes, and you can run into trouble if you cannot replace this water or the electrolyte loss, right? So people with more advanced kidney or heart disease come to mind, people who have problems with increasing their oral intake effectively and are more prone and threatened by dehydration. This is people of the extremes of ages, such as babies or the elderly. Since it can last longer and be more severe in immunocompromised, that's another group that you would worry about. All those need to worry a little more. The rest of us probably should worry a little less about this when you read the news these days.
So, if you decide that it's time to go see the doctor, how is cyclospora diagnosed? And it sounds like hydration is a big part of care, but talk to us a little bit about that.
Yeah, so we've known about this for a long time and really have been able to diagnose this forever. It just used to require a special stain, which was often not ordered because it was complicated and because most providers appropriately probably felt that this was not a priority, especially initially. Now it's part of the so-called GI pathogen panel, which is a multiplex PCR, so PCR that detects multiple bugs at once, which has really become more fashionable and more popular over the last couple of years. And when there's an outbreak, the test is used even more often, and we find even more cases. So typically, the cases we diagnose, and every year we diagnose a couple. We've diagnosed a couple in this year, and even in our healthcare system. But they're typically the tip of the iceberg, right? For everyone diagnosed, there's typically a boatload more. The test is expensive and finds stuff that's often inconsequential. So I would really only recommend ordering it if it results in change of your care or your patient's care. But there is a test available for that that's now expensive but pretty straightforward. Treatment is also straightforward. Replacing water and electrolytes is number 1, 2, and number 3. And you should overhydrate, which the simple test is if your urine is dark, you're not hydrating enough. So that's the easy way to check for that. But cyclospora responds very well to certain antibiotics. Most people may not need antibiotics, but if you do a 7 to 10 day course of a sulfa antibiotic, should do the trick in most patients. If you're sulfa allergic, can't tolerate that, we have alternatives, and that's probably a reason to see one of us to get that going. Let's quickly mention the do nots in treatment. Medication that stop diarrhea, such as Imodium that people know from over the counter, are not to be used and are not helpful. If you think you have an infectious gastrointestinal illness, it doesn't matter whether it's salmonella or viruses or even traveler's diarrhea or now this, don't try to stop the diarrhea. Replace the water that you're losing. Trying to stop the diarrhea often does not work anyway, but don't stop the body from getting rid of how it knows to get rid of these, which is flushing them out.
So you have to let it run its course, huh?
Yeah.
Oh
You
my.
can treat it, but not with stool or diarrhea stoppers.
Got it. Well, you mentioned that this is sort of a seasonal thing that comes up during the warmer months of the year, and that South Carolina seasonally experiences cases. So far, have the reported cases in South Carolina exceeded the normal range?
No, really not. But this will probably change because there's now an outbreak, and so we'll test more. There's actually a fairly sizable outbreak in North Carolina that we have no idea what that is due to. It's around Wake County concentrated, but they're seeing it all over the state now. And so for this year, we've seen less than we expected. But some of our cases didn't show up until there was attention to it. It's been so dismantled, our health departments, CDC, that we are probably not reacting as quickly as and getting as many cases reported. Well, they are reported, but then somebody needs to do something with it, and they seem to be short on that manpower. And so I don't know how good our surveillance is. We usually have a food net. We used to have food net, which picked up these outbreaks before they actually happened. That's gone. We don't have our EIS service at the CDC anymore, which is 150 per year. We're trained to do this, and they were our intelligence detectives. We could detach them and we could send them where these outbreaks were happening. None of that is in existence anymore. The funding has stopped for that. So I'm really not sure how good our numbers are. And that's a little worrisome. If you have 11,000 cases and really have way, way more, which we think we do, then we have a problem. But right now, with the manpower that's available for that, it's probably not fixable.
So when you mentioned that, getting back to the symptoms a little bit, when you mentioned that dehydration is an important component of this illness, is that what sends people to the hospital typically? Is that what makes people feel bad enough to feel like they really need medical attention?
Yes, that and the dehydration can cause significant other symptoms, including blood pressure drops, feeling dizzy. That's not the illness per se. That's just the dehydration. Electrolytes are important for the function of a lot of organs. Not the least of it is the heart. And if you have significant loss of electrolytes and can't replenish that, that can get you in trouble. But dehydration is the number one cause. Everyone that came into our system was essentially for symptoms of dehydration. And that's for certain people, can have a significant risk.
And when you say electrolytes, you mean things like sports drinks, right? In addition to
So
water.
sports drinks have a significant amount of electrolytes that can help. Just mineral water, if you just don't drink carbonated water, but actually mineral water has a ton of that. Regular water has electrolytes in it, but you will need to replace that. But yeah, Pedialyte and those kind of things are easy ways to replenish those electrolytes and the fluid with it. You just got to drink enough. If you lose a quart to two of diarrhea a day, which this can do, you got to replace that plus drink the extra, which you're talking drinking 3 to 4 quarts of liquids a day can be done because it doesn't cause that much nausea. But for some people, that really is a task.
The recommendation is the same for children as well as adults.
Yes, the doses are differently, but the antibiotics work in all age ranges. And again, if you have a small baby, it's fussy and doesn't like it, trying to get the fluid in there, and they're more prone to dehydration because they have more body surface. So it's clear why they run into problems quicker. But again, most people don't ever get a diagnosis, don't ever see a doctor. That's the normal. But the ones we see are typically the more serious ones.
Thank you so much for walking us through that, Dr. Albrecht. Now let's turn to the consumer side of this issue and talk about what we can do at home to safely prepare fresh produce and make informed food choices. Chelsea, thanks for joining us with some food selection and prep advice. Let's start with several fresh produce items have been linked to cyclospora outbreaks in recent years. What should consumers know when shopping for fruits, vegetables, and ready-to-eat products?
Thank you so much for having me, y'all. So yeah, in recent years, certain items have been linked to the outbreaks. It's particularly been things like lettuce, cilantro, basil, green onions, raspberries. The most important things that consumers can do is to track where those specific outbreaks have come from. And that can be done on the FDA website. You can see where specific outbreaks have been linked to. One thing to keep in mind, though, is that any fresh produce can be linked to it, but because whenever there is an outbreak, the number one thing that they will do is ask people, okay, what have you eaten in the last 2 weeks? And so sometimes it can be really hard to get reliable information with that because it's just difficult to remember. But the FDA website is going to be a great resource to actually track where those specific outbreaks have been linked to, and then where they've actually been able to detect the presence of the cyclospora in food. The majority of fresh produce is still considered safe.
Thank you so much. I'd like to remind our media partners that you can post any additional questions in the chat for us if you think of any as we go along. Chelsea, back to you. Many people assume rinsing produce completely eliminates the risk. What are the best practices for washing and handling fresh produce at home?
Yes. So there's no way to just by rinsing and washing, there's no way to completely eliminate the risk, but there are some good best practices in order to make sure that you are reducing your risk as much as possible. So the number one thing is to make sure that you're washing your hands before you're handling any kind of fresh produce. If you do have any produce that has any bruised areas, remove that. If you have a leafy vegetable, remove the outer leaves of that leafy vegetable. So think of like cabbage or even romaine lettuce. Sometimes if you remove those outer leaves, you can actually see where there's some dirt still present in that produce. If you have something that has like a really firm outside skin to it, so things like melon or like even potatoes, scrub that outer surface really well before you do cut into it or peel it. And then it is actually not recommended to use any kind of like soaps or commercial washes when you're washing your produce. So just use water, warm water, make sure your hands are clean before you're handling any produce, and then just try to remove any visible debris on your produce.
What steps can we take in our kitchens to reduce the risk of foodborne illness? And I was thinking even specifically about cross-contamination and those types of things. Any advice there?
Yeah, so there's definitely recommendations to keep your ready-to-eat food away from any food that needs to be processed or washed. So even keeping like separate cutting boards. So the number one thing I always go back to for food safety is like Food Safety 101 is if you have a separate cutting board for like raw meats versus any of your fresh produce that you have. So always keep those two things completely separate, and then again, wash your hands before and then in between preparing those two different types of foods. So in addition to washing things ahead of time, make sure that once those items are washed, that they're kept separate from the things that are not washed.
For people very concerned about recent reports, what are some safe and nutritious alternatives to commonly affected ready-to-eat produce items? I know many of us value that time in our day that we have easy grab and go things like packaged salads that we take to work or even have at home. Are there any changes folks could make if they're super worried about some of those food items right now?
Yes, if you are, if it's something that very concerns you, the things that are going to have the lowest risk, if not no risk, are going to be frozen or canned produce items, or, think of like beans. Canned beans can be a very nutritious alternative to any kind of fresh produce. It's still going to offer really great micronutrients and fiber. But one thing that can definitely eliminate your risk is if you do have any fresh produce, is to cook it. So the recommendation is to cook it to at least 158 degrees specifically, and that will kill the cyclospora. And that, if you have fresh produce that you don't want to waste, wash it for sure, and then you can cook it. So think of like bok choy, turnip greens, spinach, collards, those types of things. Those can all, if you're cooking them, you cook them to a high enough temperature. So do in your kitchen, keep a good food thermometer so you can be extra sure that you are cooking it to that temperature of at least 158 degrees to kill the cyclospora, and then it is completely safe to eat.
Got it. Are foods that are labeled, and a lot of times they're labeled pretty prominently that they're pre-washed or triple washed, are those products safer, or should we still take some steps before eating those?
Yes, they may be a little bit safer than something that's not washed completely, but anytime that we have the human element with handling our food products, we do want to take that additional step of washing it ourselves. So, even if something is like a fresh bag lettuce and says that it's pre-washed or triple washed or anything like that, I always say throw it in your salad spinner and give it a good rinse just to make sure, take that additional step at home, especially during the time of an outbreak when we have the cyclospora being linked directly back to lettuce. So yes, I do recommend, and choosing things that aren't pre-cut or pre-packaged are always going to be a safer option than things that are pre-cut or pre-packaged. So, buying your produce whole, taking it home, washing it and cutting it and preparing yourself is always going to be a safer option than something that is pre-bagged and pre-packaged.
So we might see people getting into their home gardens a little bit more.
Yes, definitely. And that's probably the safest way, is if you grow it yourself, there's no way of contaminating. I mean, not, zero risk for contamination, but much less of a risk.
Well, and speaking of that, those items that a lot of us grow at home, like tomatoes, they do have a peel, a skin, but they're more delicate. And I typically just give those a very quick rinse, and that's it. Even the ones I buy at the grocery store. Is that enough? Is there something else? I mean, do you recommend, doing a quick, like dropping tomatoes into boiling water or anything like that before we typically eat them?
That, again, with an outbreak currently going on, it's not a bad idea to throw it in some boiling water if you do plan on consuming that tomato cooked. I wouldn't recommend doing that if you plan on eating it, like on a salad or something like that. But same thing. Even though the skin is delicate, give it a good wash. I wouldn't recommend using a brush on something that has a really delicate skin, but give it a really good rinse in the sink. Make sure that you with clean hands, wash the entire outside of the surface of the produce with just warm water. Yeah.
What about any advice for people who are frequently eating, choosing salads or items that include fresh produce in their favorite restaurants? Should we be making different choices for a little while, or do you have any advice for that?
I think if you are immunocompromised, it's not a bad idea to be avoiding fresh salads in restaurants, because there have been several occurrences where outbreaks have been linked to produce that restaurants have received. Again, if the more informed that you stay, the better. So look to where those outbreaks have been linked to. Right now, it's really just shredded lettuce that it's been linked to, but that doesn't eliminate the risk for any other fresh produce. If you are in the abundance of caution, if it's something that you are very concerned about, I would avoid fresh salad bars, especially if you are immune compromised. But the best thing to do is to stay informed and avoid certain places where there has been a linked outbreak.
That's great advice. Thank you so much. I've got a couple of questions here from our media partners, and one of them, Chelsea, maybe you want to take a crack at this one, and I'm not sure if we know, but the question is, are restaurants, food banks, grocery stores, and the like receiving special guidelines for their products like lettuce and berries to avoid this infection from spreading?
I believe only if there's a specific linked recall to something. So if they have a distributor or a company where there has been a linked outbreak where the presence or they've tested positive for for cyclospora or any kind of foodborne illness, they will pull that from the shelves in restaurants and grocery stores. But we don't know until it's been detected.
Understood. I'm going to bounce this question back over to Dr. Albrecht. Dr. Albrecht, the question is there any way to estimate how long the outbreak will last? And I know you mentioned there are multiple outbreaks. So I guess if you pick one and it runs its course, how long does that typically take before we see maybe things corrected on the production and distribution side?
Yeah, that's an issue of food safety, right? You got to identify the source and you're gonna withdraw it, and then it fizzles out. But there's so many others, and there's just a lot more limited surveillance in the last couple of years because we've dismantled that. But as a reminder, most of the cases that they've found here in South Carolina predate that large Midwestern outbreak, and none of our cases have anything to do with that Midwestern outbreak. So and since a lot of our patients had very different lifestyles and things, there's also outbreaks going on here, and in North Carolina is a big one. But it will fizzle out after the summer when the temperatures are not conducive anymore to these spores being. But we could have sort of avoided some of this by identifying this a little quicker if we had that infrastructure still left. But could I just say a little bit about, I think we should make very clear that the health benefit of veggies, and especially of salad, far outweigh the risk of them. Even if there's thousands of cases, there's thousands of positives in veggies and salad. If you take the head of lettuce, that it's not the shredded that you find that you don't know where it came from, but if you have a head of lettuce from South Carolina and can peel the outer leaves off and wash that head of lettuce, you should have zero risk of getting cyclospora from them. And just as a reminder also that just because they are suspecting salad and Taco Bell, it's not confirmed that either of them have anything to do, even with the large outbreak in the Midwest. That's not really probably anywhere else. Not a big Taco Bell connoisseur, don't go there, but I would have no problems going there in South Carolina or eating salad there. It's the last salad outbreak we had a couple years ago turned out not to be a salad outbreak at all. It turned out to be the sprouts that you put on the salad. And since we don't have our epidemiology intelligence services anymore, we're not finding out what this really is. They're blaming the salad and they're blaming a restaurant. And there's clearly several patients who have not eaten there. So it's still not fully clear. And again, it's only one. It's the largest one. but there's dozens of other outbreaks. So mentioning the other things, how you can safely eat in the summer, actually applies to everything. But the last point is mentioning soap and other things. This parasite is notoriously immune to chlorination. None of that helps for this specific parasite. That's how we actually test it, that it can survive that. But you can have swimming pool outbreaks, right? So skipping the swimming in a community pool if you have diarrhea should be standard behavior. It's too large to slip through the regular filters that we use for filtration. So drinking tap water is safe. There's other ones that can weasel through this. This cannot. So tap water is safe. Don't drink from streams and lakes if you don't know what's between the spring and you. Just don't. You can not only pick up this, but other things as well. And then wash your hands always, as was said, and twice if you have diarrhea. If you have diarrhea, don't prepare food for others, not at home, not in restaurants. Call out, not for community events. That's how this kind of stuff can get around. But in the end, this is not the end all. This, if we had a more serious outbreak, I would be a little more worried with the current structure of our epidemiology and our surveillance status. But this one will not take us down.
Well, thank you for mentioning the water, the fact that this can be in pool, water situations too. I know things like water parks can get shut down by things occasionally happening, and so that's a good reminder about that. And thank you for reassuring us that we might not be cruising through to Christmas with this still going on. Hopefully, it will be resolved by then, and everybody will be feeling better, and it'll run its course, so to speak. I've got, let's see, another question. Let's see. The question is, if this is an infection that's been around, what has caused this outbreak to be more prominent than past years? I think you've touched on that a bit, Dr. Albrecht. Anything to add there?
No, better testing, more testing, more awareness, but also not having the stopgaps like FoodNet or surveillance makes it, the mitigation is not as good. We are not cutting the head off early enough in this outbreak. It takes us, with our current environment, way, way too long to identify these and react to them and figure out what the cause is. If you figure out what the cause is after 5 cases and remove that cause, you will not get 5,000 cases. If you don't, you may.
Right. Well, thank you so much. I think that we've gone through all of our questions. Any final thoughts on this, Dr. Albrecht?
I've given you more final thoughts than you can take care of, but I think I'm done.
We appreciate you so much. How about you, Chelsea? Anything to add about food prep advice or selections?
I think I will second Dr. Albrecht, is that it's very important that during this time to continue to eat fruits and vegetables. The benefits definitely are there, and so this is not a reason to completely avoid all fresh produce, as long as you're taking the proper steps to make sure that they are cleaned properly and handled properly.
Great advice. Well, thanks so much. I wish everybody good luck in navigating this. And thank you to all of our media partners who joined us today. If we can help you with any follow-ups, reach out to one of the members of our team here at Prisma Health. And we'll have this recorded and available if anybody needs a clip and didn't manage to get what they need. So again, thanks for joining us, and we'll see you next time on our Timely Health Topic Zooms.